child is not eating properly, he's losing weight, and he don't look good, he looks skinny, whatever. To reassure mother, what do? You review growth chart, you check their height and weight, and if person is, you know, normal in their growth chart, then reassure mother. That's the only thing you review. You check their height and weight, review growth chart. That's how you can reassure mother who is worried about the child having nausea, vomiting, diarrhea, and losing weight. Coarctation of aorta, where their aorta is getting stenosis, which is narrowing of the aorta. That's coarctation of aorta. So remember, when aorta goes down around the chest cavity, right, and when we check the blood pressure in the upper arm, that pressure is gonna be high because there is a sphincter or stenosis just above, which is on the aortic arch. Okay, that's the reason that blood from the heart is trying to push, and that's why when we check the blood pressure on the upper arm, it's gonna be high, it's gonna be elevated. That's why for a person who has coarctation of aorta upper extremity, blood pressure so high, high blood pressure in the upper extremity and bounding pulse because the heart is pumping so hard, okay, to get that stenosis, to blood that go through that stenosis. That's why blood pressure is high in upper extremity and pulses are bounding, okay, bounding pulse and high blood pressure. In the lower extremity is just gonna go down, low blood pressure and weak and feeble pulse. Okay, what do we do? Order x-ray, echocardiogram, and EKG. Pyloric stenosis, there is sphincter of their pilus. Okay, they have sphincter going on, and this newborn is eating something, and all of a sudden they have projectile vomiting. Everything's coming out because food is not going down. That's why it's coming out. Pressure is high, so it's just backing flow everything. So projectile vomiting is the classic sign for pyloric stenosis for newborn. And also you can feel olive shaped mass in the right upper quadrant. If you want to know what's going on, get the ultrasound and then refer patient. Intussusception, next thing is intussusception, which is telescoping of the intestine. Small intestine, one part goes in the other and is jamming up. That is intussusception. That newborn would have current jelly-like stool, nausea, vomiting, and sausage-shaped mass. Okay, what do? You can get the X-ray to check it out, and then definitely keep that person or patient newborn NPO. We already talked about this orbital cellulitis, soft tissue, adipose tissues, fat, everything is swollen, and this person would not be able to move the eyeball. That person gotta go to the ER. Encoparesis. Encoparesis pretty much, see that colon is impacted with fecals. Okay, so this is encoparesis, which is this child is constipated, but it appears that he's not constipated. Okay, because it says period of loose stool with staining underwear. Then you may feel like, yeah, this guy is probably having diarrhea. No, but it's totally opposite, because it says periods of loose stool with staining underwear. It's not coming out properly. Okay, that is constipation for more than 5 days. That is encoparesis. What do? You give them enema to relieve constipation. Neuroblastoma, nephroblastoma. Okay, one says neuro, one says nephro. If I look at those names, then I feel like one tumor is gonna be in the brain and one is gonna be in the kidney, but it's not like that. Okay, both tumors are in the kidneys, but name is different. Is because nephroblastoma, which is inside the kidneys, and then neuroblastoma, which is goes outside the kidney capsule. Okay, that's why this name is different, because nephroblastoma, which is like it stays inside the kidney capsule, and neuroblastoma, which goes outside the kidney capsule. That's it, but both are kidney tumors. And it's easy to remember because it's a neuroblastoma. So neuro, that means brain is in the middle, right? and then neuroblastoma is gonna cross the midline. Nephroblastoma stays in the kidney, so it's not gonna cross the midline. But whatever the condition is, we get the ultrasound, and that's it. Cryptorchidism, we already talked about this. Undescended testicles, we gotta get the ultrasound and refer this patient. Acute epiglottitis, okay, main sign and symptoms. How do you identify this patient? They have drooling, hoarseness of voice, stridor. In X-ray would have thumb sign or steeple sign. That is classic for acute epiglottitis. What do? You try to maintain their airway open and refer this person to the ED. Croup, which is barky cough, their airway is getting narrowed. Most of the time it's viral condition, okay? Don't do anything. Supportive treatment, symptomatic management. Bronchiolitis, again it's viral, okay? Their bronchioles is getting narrowed. And narrow bronchioles don't get any air, less air. That's why they have shortness of breath, they are wheezing. Okay, most likely it's happening because of the RSV virus. Don't do anything. Supportive treatment. If they are wheezing, you may give them bronchodilator, but that's it. Kawasaki, they have desquamation of the hands and feet, high fever, and strawberry tongue. Those are the classic signs and symptoms. All you do is give them IV immunoglobulin and high dose of aspirin. This is the only condition where we give them aspirin, because less than 12 years of age, pediatric patient, we don't give them aspirin. Hand, foot, and mouth, again viral exanthem, viral condition. Don't do anything. It's gonna resolve automatically. They have those maculopapular rash on their hand, feet, and mouth. That's the classic sign. Molluscum contagiosum. They have smooth, round-shaped nodule with central umbilication. There is little dot, in the middle. There is molluscum contagiosum. This is very contagious as well. If it's noted in the child's, growing area, that means they may have, you can suspect sexual abuse. Scarlet fever, where it's all about S. They have sandpaper rash, they have sore throat, strawberry tongue. There is scarlet fever. They also have red beefy pharynx as well. Fifth disease, again, as you can see, they have those, lacy macular rash. That's common in fifth disease. It's caused because of parvovirus B19. Very important question is, what do? Don't do anything. Supportive treatment. It's gonna go away. It's another viral exanthem. But this is very contagious. So what do? When this child can go back to school? So the answer is, once rash appears, okay, that patient is no longer contagious. As soon as you see that lacy macular rash, they're good to go, because they will have fever before rash. So when fever subsides and rash appears, they're good to go. Nursemaid's elbow, it happens to like infant, or toddler, because they don't listen, and then parent are trying to pull their arm, trying to get them to do something, and then there we go. It's getting dislocation. That is radial head subluxation. That is called nursemaid elbow. Mononucleosis, we already talked about this. Fever, chills, malaise, feeling tired. Main sign and symptoms is posterior cervical lymphadenopathy. Posterior side, okay? If it's strap, it's gonna be anterior, mono, posterior. Definitely avoid contact spots for 4 weeks. So here we have rubella, and roseola, okay? So I'm going to make this easy for you. Remember, look at the name and you'll figure this out. Rubeola, okay? O-la. So O in the middle, that is ordinary measles. O in the middle, that means they have conjunctivitis, coryza, cough, because everything has O in it. Coplic spot, O in it, right? So it's all about O. Rubeola, it's all about O. Okay, conjunctivitis, cough, coryza, ordinary measles, and Koplik spot. Everything has O in it. That's rubeola. Okay. Another thing you have to remember, they're gonna have rash. That's gonna look. This guy is screaming. It's gonna look like he's screaming, and he has this hairline red color hairline rash. Okay, that goes like starts from the hairline and then goes down cephalocuddly. Okay, from top to bottom. That's rubeola. Rubella. Okay, I look at that. This probably is a lady in the middle. Okay, that child is a female, and because it's kind of sound like rubella. Okay, so Bella came from Germany, which is German measles. Okay, so Bella came from Germany with lymphadenopathy. You see that popping out? Her lymph glands are swollen. Okay, she also has kind of like signs and symptoms of mononucleosis, lymphadenopathy, low grade fever, feeling tired, fatigue, sore throat, stuff like that. So Bella came from Germany with lymphadenopathy. She had cheeks were red. She was pretty looking, and then she has rash that is also cephalocuddly, which is goes top to bottom. Okay, and roseola infantum is rosy baby. This is how I remember that. Rosy baby. Okay, that baby, face is not red, everything else is red. And why is it red? Because they have maculopapular rash. Neck down, okay, not on the face, neck down, they have maculopapular rash. That is rosy baby. And here's the main thing, fever subsides. This guy would have fever first. Then fever is gonna be gone, and then his body is gonna turn red. That is rosy baby. That is roseola infantum.